Hi, everyone. My name is Lisa Nunes, and I am a senior at Altman College's School of Nursing in their pre-licensure BSN program. And I'm here today to present my nursing leadership quality project that I've been working on this semester. So just to go over some objectives for this presentation, we're here today to determine if nurse call-out response times has an impact on high-quality patient care. Um, does the same objective have an impact on patient safety or patient safety indicators? What effect does long call-out response times have on nursing? Because nurses hear call-outs all day, every day of their shift. It is a very relevant thing to nursing, and it can definitely have an effect psychologically on nurses when they just hear call out after call out. Um, Definitely has a physical impact on our patients and a little bit of a psychosocial, but it definitely stresses a nurse out to know that call outs are going off and they're not able to address patient needs. And then lastly, I'm going to explain how I would personally set up a hypothetical study to further research this very important and crucial health quality issue we see in our current field of nursing. So, as you know, my topic is nurse call out response time. As we can see, there is a positive correlation between nursing staff response time and patient safety indicators and patient satisfaction. So, as we can see, there is a positive correlation, which means when one goes up, the other variable goes up. The longer nurses take to respond to a call out, the higher the risk is for falls or another sentinel event, which could happen from injuries from falls, can cause a lot of trauma and lead to patient death or serious patient injuries. And then the longer nurses take to respond to a call out, the more frustrated and unhappy a patient might be feeling. So again, positive correlation when one goes up, the other variable goes up. And then for safety, call out response time directly correlates with the Joint Commission Patient Safety Indicator of 2021, NPSG 0.06.01.01, which is aptly titled Using Alarms Safely. The main purpose of this indicator was to make improvements to ensure that alarms on medical equipment are heard and responded to on time. I think that is a very important quote because not only is it important to make sure nurses can hear the alarms, but long are they taking to responding? Because if they are hearing alarms but not responding, that still leaves patients vulnerable for a safety incident to occur. And then while there was nothing of a nurse sensitive quality indicator directly relating to call out response time, I did find one that correlates with it with falls prevention. Now, this list was published in 2007, and falls prevention was a big safety issue back then and obviously very relevant in our year 2021. So, later on in my literature review in this presentation, I'm going to explain how call outs can impact fall prevention and either help it or hurt it. So, my first article, why is this relevant to nursing? What do call outs have to do with nursing? Not a lot of people know what call outs are, I think, until they're a patient or a loved one is a patient in the hospital. They certainly don't show it on TVs. You don't hear like a doorbell sound or a constant alarm in the background of like Grey's Anatomy or House or other ones. So a lot of people don't know the reality of stepping onto a medical surgical unit. My first article focused on fall risk, and it showed that falls are more likely to occur if a patient feels that they have to get up on their own. Why would a patient feel the need to get up on their own? Well, here's a scenario. If a patient has set off their call light, they have to use the bathroom, 5 minutes goes by, 10 minutes goes by, and a nurse still has not responded, they're going to think, I still have to go to the bathroom. I'll get up and take myself. And this could be very problematic if they suffer from orthostatic hypotension, had an epidural recently, or are confused or any other fall risk. It could be very hazardous for them to get up by themselves. But their needs have not been met, so they're going to do it themselves if their call light has not been answered. This research study showed that 38% of participants reported a prolonged wait for staff after they used a call light, while 13.8% of these participants felt like they were waiting for nurses to meet their needs, like toileting assistance. And this highlights the need for urgency patients feel when they hit that call light. They're not just hitting the call light to say, hi, hello, how are you? They're hitting that call light for a reason. And most times, like 9 out of 10, it is for a very urgent reason that should be addressed in a timely manner. Article 2, I wanted to not only research the impact that long call out response times would have on nurses and patients, but also why. What is causing these long response times? Some articles pointed out nursing ratios like a large patient workload, lack of aides. I know from personal experience in clinicals just throughout my student nurse career, I have seen if nurses have like a 1 to 8 nurse to patient ratio, they are not enough bodies to answer call lights in a timely manner. If you have 4 call lights going off with a need to do medication passes, assessments, vitals on 8 patients, it can get very overwhelming. But that is really a different quality issue that I won't be going into, but just I wanted to make the audience aware of that. But one of the biggest reasons I found in my literature review related to why nurses take so long to answer call lights sometimes is something called alarm fatigue. And alarm fatigue is when a nurse or nursing support staff gets so used to hearing that call light that they just start to tune it out. They become subconsciously desensitized to it, and it becomes very hard to differentiate the different alarms and call lights and what you're hearing, especially when there's a lot of noise pollution on the unit. If a nurse is focused in and charting, they might not even be aware that 1 or 2 different call lights might be going off. Um, Alarm fatigue has been linked with endangering patients and increased response times to call lights. So it increases the amount of times it takes for nurses to respond to the lights, which, as we highlighted on the last slide, can leave patients vulnerable to falling or other events. Um, it can be said that alarm fatigue influences possible negative clinical impact, and it may cause frustration and confusion among nursing staff, and a hesitancy to respond to a call light. So, if there is not a clear hierarchy of who should respond to call lights, if nurse A is in patient X's room doing a medication pass, and nurse B is at the nurse's station charting, and one of nurse A's call lights are going off for a different patient and they're in a patient room, does nurse B answer the call light? It's not their patient, it's not their responsibility. So without clear objectives of who needs to answer call lights, it can contribute to frustration and longer response times for nurses. And then my last article, it kind of explains why call lights are so important to patients and how it impacts patient satisfaction. So it can be clearly described as call lights being a means of communications for patients to their care providers that are outside the patient's room. A patient is going to sit on their bed and see the same 4 walls during their hospital stay. That call light is a direct line to their nurse. And when they're in trouble, if they can't get out of bed, they can't get out of the room, they're relying on that nurse or nursing support staff to come and address their need after they hit that button. Patients are unaware of the circumstances going on outside their room. They might not be aware patients coding down the hall, or there are 2 rapid responses coming, or there is an IV stat medication that needs to be pushed. They don't know that. They just know their needs and how long they've been waiting. So that is why how long it takes for a nurse to respond to their needs and their call out is what they will perceive as a direct reflection of quality patient care. The longer it takes for call out to be responded to, the lower quality care they think they're getting. It can also cause a lot of nurse distress. Like I said earlier, nurses have a lot to do during their shift. It is a very caring career and filled with people who want to help others, help them heal. And it can be very distressing, stress inducing, and anxiety inducing to hear call lights going off if you're helping one patient and know you can't attend to another patient's need. So my hypothetical research question would be, in hospitalized adult patients on a medical surgical unit, how effective are call light response times in under 5 minutes versus response times over 5 minutes in raising patient and family member satisfaction during a hospital stay? So this would be a qualitative study, meaning it doesn't rely on numerical data, but rather patients' feelings and how they describe their experience. So my sample population and data collection method would be, I would take a medical surgical unit from a local hospital. I would choose that one unit, and my sample population would be specifically adult patients from this chosen medical surgical unit admitted between June 2021 and October 2021. Patients and their families would be given a standardized questionnaire or survey, asking for feedback on how long it took call light responses and their interpretation of high quality care. Would they say they had great satisfaction? Would they say they had great quality care? Would they say their call lights took over 5 minutes or under 5 minutes? It'd be gathering those responses to see what correlations or trends could be identified. And then I thought a quantitative study would also help with the safety with the falls. It would aim to answer the research question if longer call out response times influence the amount of patient falls on a unit, it would be with the same sample population on the same adult medical surgical unit. To get the data for this, I would utilize chart audits or talking with the quality team to see the number of adverse events, to see how many incident reports or variance reports are filed for patient falls, and an observer would be on the unit to see how long it took call light to be answered over the same June to October timeframe. So what I think my expected findings would be, I think shorter response times would be linked with increased patient satisfaction. And on the flip side, there would be a negative correlation of the longer it took for patients to have their call out responded to, the decrease in satisfaction. So we mentioned and defined what a positive correlation was earlier. A negative correlation is when one variable goes up, the other goes down. Um, Another expected outcome from this research project would be the quicker nurses attend to patient needs, the higher satisfaction results would be shown on the survey. So positive correlation, the happier the patients are with the shorter the times. So we really want to keep those call light time responses low and as quick as possible. I know patient satisfaction is a huge thing with hospitals because a lot of times reimbursement or funding can come from patient satisfaction surveys. So it is very important that nursing and nursing support staff can show they have high quality care by answering call lights quickly. Now, in this hypothetical study, it doesn't address the other quality issues like resources available, staffing, the number of bodies on the unit. There's a lot more that goes into it than just telling nurses answer that call light faster. More in-depth studies would need to be done on these other health quality issues to really dive deep and determine how to give nurses the tools and resources to succeed in answering these call lights quicker. And then in my quantitative study, I'd assume that expected results would show that faster response times, i.e., response times under 5 minutes, would show less patient falls because if nursing or nursing support staff are answering those calls quickly, it gives less of a reason for patients to get up by themselves and have that risky patient behavior like we were talking about earlier in the literature review. So if a patient hits a call light button and within a minute or two a nurse comes by and is like, ask them if they need help to the toilet, assist them, they know when they hit that call light to get off the toilet, someone's going to be there to help them. So they'll be supervised and properly educated, and it'll really reduce their risk of falling that if they just sat there while the call light went off and got up by themselves. So student learning outcomes, basically overall, what did I learn from this course and how would it affect my specific quality issue? This course has definitely shown how important change is, and how important it is that nurses can see a change, see a need for research to gather evidence-based practice, like I mentioned earlier. Change begins with a strong nurse leader. That leader is there to help influence, a whole unit to adapt to change and help improve quality care, because high quality patient care is always the goal of nursing. And this course taught me that a nurse leader could be a student nurse, it could be a new grad nurse, it could be an experienced floor nurse, it could be a nurse manager. Anyone has the ability to be a leader to point out change. Now, as that changes, research and changes are needed to unit culture to really adapt to better quality care. This might require more structured leadership. And this course specifically taught me the best type of leader for that structured change is a transformational leader. Anne Finkelman in our class textbook defines a transformational leader as someone who emphasizes a positive work environment, recognition of the importance of changing and using change effectively, rewarding staff expertise and performance, and the development of staff awareness. So, transformational leader is not going to come in as an authoritarian and say, you're going to do this new policy, you're going to change how you practice on this unit, or you will be written up. They do more of a people approach. They're very in tune with their unit. They're very in tune with their patients and their patient population. So they're going to sit down, they're going to break it down and say, we've noticed that call lights go off for X amount of minutes on our unit, and that has increased our falls by so much percent. They're going to explain to the staff how this current out variable is impacting how it impacts quality patient care. They're going to say, we've done some research, present some of the data. We have determined with these outcomes, our next actions could be to implement a new call light system. People might be resistant to change to new technology used. So that transformational leader will be there to help them adjust and really motivate them to change. Or we're going to hire some new techs or some new aides to make sure there are people to answer call lights. People might be resistant to new staff, or maybe not as inviting to new people. So, transformational leaders are going to assess the work culture and really work to make sure that culture is welcoming, to help embrace those new hires, to help with the call out response time and thus increasing patient care. Here are my references. I use quite a bit. For my literature review, I tried to keep a couple of nursing articles from within 6 years, because evidence-based practice is an ever-changing field in nursing. So we want to make sure we're pulling from recent articles. But then some were just from like 2007, like those nurse quality sensitive indicators, because that was the original list. Um, but overall, those are my sources, and I had a really good time researching this. I definitely saw the prevalence of this issue throughout all of my clinical experiences, whether it be in transitional or rehab care, a medical surgical unit, dialysis, pediatrics, obstetrics, critical care, step downs. In every unit I saw, call it response time was always an issue. So hopefully, as I develop my professional career, I can help develop some research in this area and hopefully have an impact on it in future nursing practice. Thank you so much for watching.